This recording will go over obesity. An obese adult weighs at least 20% above the upper limit of the normal range for ideal body weight and has a BMI of 30 or more. Morbid obesity refers to a weight that has a severely negative effect on health, usually more than 100% above the ideal body weight and a BMI over 40. Overweight is an increase in body weight for height compared with a reference standard, or up to 10% greater than ideal body weight and a BMI of 25 to 29. More than 1/3 of Americans have obesity. This problem is the second leading cause of preventable deaths in the United States, second only to smoking, and has become a national crisis. The pathophysiology of obesity is very complex. A number of chemicals in the body, including hormones known as adipokines, work together to affect appetite and fat metabolism. Leptin is a hormone released by fat cells and possibly by gastric cells. It also acts on the hypothalamus to control appetite. Adiponectin is an anti-inflammatory and insulin-sensitizing hormone. Resistin is a hormone produced by fat cells that creates resistance to insulin activity. Inflammatory cytokines such as inflammatory interleukins and tumor necrosis factor alpha also play a role in obesity. Apolipoprotein E is one of several regulators of lipoprotein metabolism. Cholecystokinin is a hormone that stimulates digestive juices and may work with leptin to increase or decrease appetite. Ghrelin is known as the hunger hormone, and it is secreted in the stomach. It increases in a fasting state and decreases after a meal. Orexins are appetite stimulants. An example of this is ghrelin. Anorexins decrease appetite and include leptin and insulin. Increased circulating plasma levels of orexins are associated with the development of obesity. However, in some adults, high levels of leptin may not be effective in suppressing appetite, a condition known as leptin resistance. In this case, overeating and excessive weight gain can result. Hyperleptinemia also stimulates the autonomic nervous system and contributes to blood vessel inflammation and ventricular hypertrophy. Obesity is also associated with insulin resistance, which predisposes patients with obesity to type 2 diabetes mellitus. The distribution of excess body fat, rather than the degree of obesity, has been used to predict increased health risks. For example, the waist circumference is a stronger predictor of coronary artery disease than is BMI. A waist circumference greater than 35 inches in women and greater than 40 inches in men indicates central obesity. Central obesity is a major risk factor for coronary artery disease, stroke, type 2 diabetes, some cancers, sleep apnea, and early death. So you might have heard about a person being apple-shaped or pear-shaped. So the apple shape would be a patient with an increased waist circumference, right? Putting them at increased risk for that coronary artery disease and the other chronic conditions that come along with that central obesity. The major complications of obesity affect primarily the cardiovascular and respiratory systems. However, excess weight can also cause degeneration of the musculoskeletal system, especially the weight-bearing joints such as the hips and knees. Obese adults are also more susceptible to infections and infectious diseases than our thinner adults and tend to heal more slowly. The cause of obesity involves complex interrelationships of many environmental, genetic, and behavioral factors. One of the most common causes of being overweight or obese is eating high-fat and high-cholesterol diets. Obesity is associated with diet when it contains a significant amount of saturated fat, which increases LDLs. Trans fatty acids, saturated fats, and cholesterol are linked to a higher risk for heart disease. Physical inactivity has also been identified as another cause of being overweight and also of obesity. Another cause of obesity is drug therapy. Some prescribed drugs contribute to weight gain when they are taken on a long-term basis. These include corticosteroids, NSAIDs, some antihypertensives, antidepressants, antiepileptics, some oral antidiabetic meds, and some estrogens and certain progestins. Obesity is a major public health problem and is associated with many complications, including death. As a result of this increasing problem, the Healthy People 2020 agenda addresses the need to reduce the proportion of children, adolescents, and adults who are obese. Healthy People 2020 objectives for nutrition and weight status include specific population targets related to obesity and health nutrition habits. Review the table in your textbook that goes over the Healthy People 2020 objectives and targets. In collaboration with the dietitian, teach the importance of weight management and exercise to improve health. Patients with obesity may be embarrassed or reluctant to talk about their weight or fear judgment because of the stigma that can be attached to this condition. Approach patients with obesity by using the acronym RESPECT. Create rapport with them in an environment that is safe. Ensure their safety and privacy. Encourage them to set realistic goals. Provide compassion and use tact in conversation. In addition to taking a complete history regarding present and past health problems, collect this information about the patient in collaboration with the dietitian: economic status, usual food intake, eating behavior, cultural background, attitude towards food, appetite, chronic diseases, drugs, physical activity and functional ability, family history of obesity, and developmental level. Obtain an accurate height and weight. The dietitian calculates the percentage of ideal body weight. He or she may also measure the waist circumference, calculate waist to hip ratio, and determine arm and calf circumferences. The dietitian will also calculate the body mass index, or BMI. Examine the skin of the patient with obesity for reddened or opened areas. Lift skin fold areas, such as pendulous breasts and abdominal aprons, known as panniculus, to observe for candida, yeast infections, or other infections or lesions. Infections of the panniculus is referred to as panniculitis. Obtain a psychosocial history to determine the patient's circumstances and emotional factors that might prevent successful therapy or that might be worsened by therapy. The results of dieting and other efforts can lead to a sense of failure and lowered self-esteem, which often stimulates more overeating. Many overweight and obese adults eat in response to environmental and emotional stressors rather than because they are hungry. Ask the patient to identify their perceived stressors and what triggers their need for food. Lifestyle changes are difficult without adequate family and community support. Obese men often experience erectile dysfunction, which can cause or worsen depression. Women often experience changes in their menstrual cycles and may have problems getting pregnant. The priority collaborative problem for the patient with obesity is weight gain due to excessive intake of calories. Diets for helping adults lose weight include fasting, very low-calorie diets, balanced and unbalanced low-energy diets, and novelty diets. Short-term fasting programs have not been successful in treating morbidly obese patients, and prolonged fasting does not produce permanent benefits. Very low-calorie diets generally provide 200 to 800 calories per day. Two types of these diets are the protein-sparing modified fast and the liquid formula diet. The protein-sparing modified fast provides rapid weight loss while preserving lean body mass. Both diets require an initial cardiac eval, supervision by an interdisciplinary healthcare team with monitoring by physician, nutrition counseling by a dietitian, and supplementation with vitamins and minerals. Patients who are on these diets should receive nutrition education, psychological counseling, exercise, and behavior therapy. Comparable weight loss have been achieved with both diets, but again, most patients regain the weight they've lost. Nutritionally balanced diets generally provide about 1,200 calories per day with a conventional distribution of carb, protein, and fat. These diets provide conventional food that is economical and easy to obtain. Thus, the outcome of weight loss is facilitated, and it is hoped that loss is maintained. Unbalanced, low-energy diets, such as the low-carbohydrate diet, restrict one or more nutrients. So this would be like the Atkins diet. Protein and vegetables are encouraged, but certain carbs and high-fat foods are not. Although they remain controversial in the medical community, these diets are extremely popular. Novelty diets, such as the grapefruit diet, the cookie diet, and the Hollywood diet, are often nutritionally inadequate. This type of diet implies that a certain food or liquid increases metabolic rate or accelerates the oxidation of body fat. Weight loss is achieved because energy is restricted by food choice, but patients do not sustain weight loss after stopping the diet. Nutrition recommendations for each patient are developed through close interaction among the patient, family, physician, nurse, and dietitian. The diet must meet the patient's needs, habits, and lifestyle and should be realistic. A reasonable expected outcome of 5% to 10% loss of body weight has been shown to improve glycemic control and reduce cholesterol and blood pressure. These benefits continue if the weight loss is sustained. Along with change in eating habits, a major intervention to manage obesity is to increase the type and amount of daily exercise. Encourage sedentary patients to increase their activity by walking 30 to 40 minutes at least 5 days a week. A BMI of 30 or a BMI of 27 with comorbidities is one indicator for the use of drug therapy. Anorectic drugs suppress appetite, which reduces food intake and, over time, may result in weight loss. Orlistat inhibits lipase and leads to partial hydrolysis of triglycerides. Because fats are only partially digested and absorbed, calorie uptake is decreased. Most patients taking this drug have GI symptoms that include loose stools, abdominal cramps, and nausea, unless they reduce their fat intake to less than 30% of their food intake each day. Lorcaserin works by activating the serotonin 2C receptor in the brain to help decrease appetite and create a sense of feeling full after eating small amounts of food. Teach the patient to report signs of a rare but serious side effect of serotonin syndrome, including suicidal thoughts, psychiatric concerns, and problems with memory or comprehension. Phentermine topiramate combines a short-term weight loss drug, phentermine, with a drug that is used to control seizures, topiramate. Teach the patient that a rare but serious side effect associated with this drug is suicidal thoughts, which should immediately be reported to the prescribing healthcare provider. Naltrexone bupropion combines the opioid antagonist naltrexone with the antidepressant bupropion. Patients with uncontrolled hypertension and seizure disorders should not take this drug. Teach the patient about the possibility of an onset or increase in suicidal ideation and behaviors, as well as neuropsychiatric reactions. Liraglutide injection activates appetite regulation in the brain, which decreases caloric intake. Patients taking insulin should not take this medication. Serious side effects can include risks for medullary thyroid carcinoma, hypoglycemia, renal impairment, suicidal behaviors, and acute pancreatitis. Other sympathomimetic drugs suppress appetite for short-term use, along with a structured weight management and exercise program. These drugs act on the central nervous system, including suppressing the appetite center in the hypothalamus. Patients with hypertension, heart disease, and hyperthyroidism should not take anorectic drugs because they may worsen their symptoms. These drugs are not prescribed for any patient taking psychoactive agents because they cause similar side effects. Teach patients who are candidates for sympathomimetic drugs about side effects, which include palpitation, diarrhea or constipation, restlessness, insomnia, dry mouth, blurred vision, change in sex drive or activity, and anxiety. Behavioral management of obesity helps a patient change daily eating habits to lose weight. Self-monitoring techniques include keeping a record of food eaten, exercise patterns, and emotional and situational factors.